Welcome to my video, Perineal Fascia and Spaces for Smarty Sparties. As an anatomist, I would not be doing my job if I didn't torture you with a bunch of boring facts on perineal spaces and fascia. Fortunately for you, however, is that the goal of this video is to take out all that mumbo jumbo and provide you with the bareback necessities for understanding just a few important clinical presentations. I'll be using this model for much of the video, so let's first get oriented to some of the pelvic musculature. First off, we have this funnel-shaped musculature located right here that would also be present on the other side, but deep to this fatty layer. This is the pelvic diaphragm. We also have this sheet which is spanning between ischiopubic ramus and ischiopubic ramus. This is the perineal membrane. Now keep in mind that the pelvis is correctly oriented like this, so the pelvic membrane is a horizontal plate almost that helps to support some of the pelvic viscera. Lastly, of the musculature that we need to remind you of is the obturator internus muscle. Now that is going to be lying deep within the pelvic cavity, forming the lateral wall. You can't really appreciate it terribly much from this model and this view. However, if we move the pelvis like this, you can get a glimpse of it as this internal portion of muscle that covers the obturator foramen. If you look at the undersurface of a pelvis, aka the perineum, it's easy to visualize the triangle. The triangle's borders are formed from the two ischiopubic rami and posteriorly the sacrotuberous ligaments. Now the sacrotuberous ligaments are not exactly visualized within this specimen or within this model. However, we know that they would be running from the ischiotuberosity to the sacrum. Now the perineum can further be divided into two triangles. The anterior triangle being the urogenital triangle and the posterior triangle being the anal triangle. The urogenital triangle contains namely the urethra, vagina, and vulva in females, and the urethra and root of the penis and scrotum in males. The anal triangle consists mostly of the anal canal. Both of these perineal regions are going to contain numerous muscles, fascial layers, and even pouches that are going to need to be further discussed. Before moving on to fascia, however, I think it's worth taking note of a structure that lies at the junction between the urogenital and anal triangles, and that is the perineal body. What is the perineal body? It's a fibromuscular mass that marks the convergence of numerous muscles. So here you see some muscles coming together just at the perineal body. Now, I don't want to dwell on naming all the musculature itself, as a more important concept is that the perineal body is essential for maintaining the integrity of the pelvic floor, especially in females. You can think of these linking muscles as crossing beams that support the overlying pelvic diaphragm. Stretching or tearing of this linking system weakens the support and could lead to prolapse of any of the pelvic viscera, including the bladder, uterus, and/or vagina. As like everywhere else in the body, the perineum is covered by a layer of superficial fat or subcutaneous fat that lies just deep to the skin. All this is saying is the parts of your body where you can pinch an inch. Now, we don't normally think of pinching an inch in the perineum. However, the labia majora and mons pubis in the female are comprised of this same fatty material. In fact, the superficial fat in all regions of the body is continuous with itself throughout the body. What this means is that the perineal superficial fat is continuous with the abdominal superficial fat, the ischioanal superficial fat, and even the superficial fat of the thigh, which isn't pictured here. The significance of this is that infections that lie within the superficial fat, such as cellulitis, have an open pathway to other regions of the body. So an infection that lies in the superficial fat of the perineum can easily spread into the superficial fat of the abdomen, thigh, or ischioanal fossa. This is true in the male as well. However, it's worth noting that the superficial fat is absent in the penis and the scrotum. Now let's move on to our next layer of the body wall, which is the membranous layer of superficial fascia. Recall that in the abdomen, this layer is referred to as Scarpa's fascia. In the perineum, it is referred to as Colace fascia. Let's look at this image to remember. First, we have the fatty superficial layer. That's the one that we just talked about. Followed by the membranous layer that is located just superficial to the investing fascia of the muscles. If we were to look at this using our model, Colace fascia could be likened to this piece of wax paper which has been placed within the urogenital triangle. Now take notice that it's been positioned deep to the superficial fatty layer, which isn't present on this model, but superficial to the perineal membrane, which would be lying deep to this wax paper. Also take note that Colace fascia is continuous with Scarpa's fascia of the abdomen. So I could add another sheet of wax paper that extends up to the abdomen, signifying this continuity. Colace fascia, however, is not continuous with the fascia of the thigh. So it attaches to the fascia lata, which is that stocking-like fascia that wraps around all of the musculature of the thigh. Colace fascia is also not continuous with anything posteriorly, as it attaches to the posterior rim or that posterior edge of the perineal membrane. Now, if this is beginning to sound like a lot of minute detail, it is, but you're about to find out why this is important within the next few slides. But first, let's use this mid-sagittal image of the female pelvis to confirm our understanding. Colace fascia of the perineum is in light blue. Now notice that it attaches to this green structure posteriorly, which is the perineal membrane. That if you follow it anteriorly and superiorly, it blends with Scarpa's fascia of the abdomen. In the male, there is also a membranous layer of superficial fascia that covers the penis and the scrotum. When in this region, it changes its name to dartos fascia, but keep in mind that it is the same layer as Scarpa's and Colace, and thus is continuous with both. Now that we have some of the fascia covered, let's move on to perineal spaces. The urogenital triangle is subdivided into two pouches based on the perineal membrane. I think this is most easily appreciated with my clay recreation of the pelvic musculature. Now recall that this red sheet represents that horizontally placed perineal membrane. So anything that is located superficial to this perineal membrane is referred to as the superficial perineal pouch. The space that is located deep to this perineal membrane is referred to as the deep perineal pouch. More specifically, the superficial perineal pouch is a space that is located between Colace fascia and the perineal membrane. So in a location in which my probe currently is being placed. Now, structures that lie within the superficial perineal pouch include the clitoris, the bulb of the vestibule, and the greater vestibular glands in females, and the root of the penis, and thus by default, the spongy urethra in males. Now, in both sexes, there is also numerous thin muscles that nobody cares about, as well as the branches off of the pudendal nerve, as well as branches off of the internal pudendal vasculature. I'm throwing in an image so that you can see it in situ. This is a coronally sectioned female pelvis with the cut going through the vagina. Notice the floor of the superficial perineal pouch is Colace fascia, while the roof is the perineal membrane. Also notice some of the contents of the female superficial pouch, including the bulb of the vestibule and the crus of the clitoris. Now this all makes sense because we can describe the perineal membrane as providing an anchor from which the external genitalia can hang. And keep in mind this is true with the male as well. So why do we care? Because it's clinically relevant to understanding the passage of fluid from one area of the body into the next. Take, for example, a saddle injury that could result from falling on a metal beam, such as that on a man's bicycle. The mechanics involved in an injury of this sort have the potential to rupture the urethra within the bulb of the penis and tear through the tissue of the corpus spongiosum, as illustrated right here. In such an event, urine and blood will extravasate into the superficial perineal pouch. As this pouch fills with blood and urine, the fluid can also surround the scrotum and penis deep to dartos fascia and may even be found in the abdomen, filling the space between scarpus fascia and the investing fascia of the abdominal muscles. Fluid, however, will not be found in the ischioanal fossa, back in this region, because of the attachment that Colace fascia has to the posterior edge of that perineal membrane. And likewise, urine and blood will also not be found in the thigh due to the attachment of Colace fascia and scarpus fascia to the fascia lata. These attachment sites form somewhat of a cul-de-sac that prevents fluid from passing into these regions. So now on to the deep perineal pouch. And that pouch is located just here. Notice that the floor of this pouch would be described as the perineal membrane, and the ceiling of the pouch would be described as the pelvic diaphragm, or actually more specific, the fascia that covers the pelvic diaphragm. Now, why is this space important? You guessed it, movement of fluid. Before we move on to a clinical scenario, let's take a moment to look at the deep perineal pouch in an image, and also in a male image. In this clinical scenario, let's assume a fracture of the pelvic girdle has occurred, in particular, a separation of the pubic symphysis. This injury may cause a rupture of the intermediate or membranous portion of the urethra, as illustrated here. This will result in extravasation of urine and or blood into the deep perineal pouch. In this instance, the fluid can pass superiorly through the urogenital hiatus to distribute within the extraperitoneal space, or that space that's outside the perineum that surrounds the bladder and the prostate. With increasing amounts of blood and urine, the fluid can even begin to climb up the abdominal wall, but this time in an area deep to the abdominal musculature, but superficial to the peritoneum. Just in case you are still confused, let's look at the coronal image of a male pelvis again. Basically, the urethra ruptures here, and blood and urine extravasate into the deep perineal pouch. Blood is then pushed up through the urogenital hiatus and enters into the extraperitoneal region, so that you might find it surrounding the prostate and the bladder. And lastly, let's move back to the region of the anal triangle and look at the ischioanal fossa. So if I turn this model around, the ischial-anal fossa is located just here. And what it is a wedge-shaped, fat-filled space that's located just lateral to the anal canal and pelvic diaphragm, and just medial to the obturator, internal obturator muscle. Its contents include mostly fat. However, it also does include pudendal neurovasculature, as well as some of the branches that are coming from that pudendal neurovasculature. Now, it's also worth noting that the right and left sides of the ischial-anal fossa are continuous with each other. The fossa is also continuous with the deep perineal pouch. The importance of this, of course, is that an infection or an abscess that's located in one of the sides of the fossa can spread to the other side. Likewise, it could also spread anteriorly into that deep perineal pouch.